Hello, my name is Michelle Zeller. I'm going to be talking today about therapy animals in acute care and behavioral health settings. So here's our topics for discussion to begin with. Where are animals allowed? What is the value of a therapy dog? And what is the difference between a therapy dog and an emotional support dog? So let's start with our problem statement. Patients in acute care and behavioral health settings experience elevated levels of anxiety, pain, emotional dysregulation, and the therapeutic benefits of animal-assisted interventions remain underutilized, and that's because of inconsistent policies, misunderstandings, regulatory uncertainty, and institutions just not getting on board. They are concerned about allergies and public perception and liability of having a dog in their institution. Okay, so why are therapy dogs significant to nursing? So this advocacy topic is really significant to nursing leaders because they are the backbone of the hospital. They are the ones that promote holistic, trauma-informed, patient-centered care. And therapy animals fit the bill perfectly. They're low cost, they're evidence-based, they're not drugs, they're not pharmacological interventions, and they can enhance both patient satisfaction and healing and pain management and reduce staff burnout, nurses' work satisfaction, and just foster a more compassionate environment. Nobody can be sad when a puppy's in the room, right? Not that they would have puppies as a therapy dog, but you get the point. There's something about a dog inherently that makes you happy when you see them. Now, there are some people that are afraid of dogs. You know, they've had a bad experience, and that is their right to deny that animal's access to them as the patient. So, and nurses can be leaders for integration of these services, and they can do that through policy making, education, and collaboration. So we're going to come back to that slide, but why, we've talked about why this topic matters to nursing, and we're going to provide a measurable aim. So a measurable aim would be by December 2026, a 50% increase in patient and nursing staff satisfaction scores would be seen in a behavioral health unit of the hospital. So we'll talk about pilot studies a little bit later, but that fits the bill for starting small, having some wins, and having measurable goals that you can reach. Okay, let's go back to this slide because I think this one is really important in distinguishing what's a therapy dog, what's an emotional support dog, what's a service dog, because it's very confusing. And if you don't know the difference, here it is laid out on one slide. So a service dog is highly trained for very specific things for a disabled individual. They do have, per ADA, American with Disability Act, they have access anywhere their human has access. So they can go with their human. Say, for example, they're a seizure detection service dog. So that dog needs to have access to their person at all times to be effective for them and keep them from harm. So what's an emotional support dog? We've heard a lot about ESAs recently, and they've kind of gotten a bad rap. But this kind of dog doesn't really have to have any specific training. They just focus on the emotional well-being of their owner. And so it kind of gets a little wonky when they get into public and they're not trained to not be reactive, or they potty somewhere they're not supposed to. So that is, it's more of a pet that gives comfort to the owner. So the discussion we're talking today about is therapy dogs. What is a therapy dog exactly? They're not an emotional support dog. They're not a service dog. So they're usually owned by organizations, therapy dog organizations, and they are not giving specific support. They're just being a comfort, but they're different from ESAs in that they're specifically, and they do have certification. Now, that doesn't mean they can, again, just come into any place, because they're not doing a specific job. They're not doing a life-saving or harm reduction job for a specific person. So organizations have to give permission for that. So they're trained, or not trained, they're selected due to their temperament, and they have to have very good socialization. They can't be barking, they can't be pottying, just like a service dog. Okay, so we've kind of talked about this. So when we're presenting the evidence and we're saying we want to advocate, again, this is it. This is our bread and butter right here. We're talking about patient satisfaction, nurse satisfaction, reduce staff burnout, higher patient satisfaction scores, which admin will be delighted with. It's a low-cost option, high return, and it's trauma-informed and all evidence-based. Okay, so moving on to leadership. Okay, so we're going to talk about my specific leadership strengths. So I had one, my top one, and I think I'm a very number one centric person. I do have some of these other characteristics, but achiever is very obvious to the people that know me. I'm constantly wanting to tackle projects, and I work tirelessly through towards those goals and maintain momentum across the complex projects. And these strengths support the development of getting a professional team together, because getting dogs into places where patients and nurses can benefit, it's going to take a lot of people. It's going to take the nurse leaders, behavioral health clinicians, therapy animal coordinators, hospital administrator, legal advisors, infection prevention, quality assurance, quality improvement. All of these people need to buy in, get excited about it, and come together, figure out how it's going to work. And I would be dedicated to doing that. And then together, we would review all the existing practices, identify the barriers, policies that align with patient safety, the institutional values, and regulatory compliance. Okay, so how am I going to do this? How am I going to influence? So I'm going to do this by participating on ethics boards and safety committees and introducing pilot programs. I'm going to about this stuff. I'm going to get other people on board, get them excited. I'm going to engage local health departments and behavioral health task force and promote community-based models. I'm going to collaborate with state policymakers to propose guidelines. Right now, in Alabama, there's no current pending legislation for animal-assisted therapy. I'm going to align federal policy advocates through national nursing organizations that support animal-assisted therapy. I'm going to align with therapy dog organizations like Alliance of Therapy Dogs and Therapy Dogs International and National Association of Therapy Animals organizations. Those organizations are usually nonprofit, and they focus on testing, certification, registrations, insurance, legislation and upholding high standards for their therapy dog teams. Okay, so moving on to, and we've talked about all this, we're going to educate staff, provide training, lead evidence-based initiatives, get involved in policies. Okay, and again, we kind of touched on this. We're going to get involved at all levels. Pilot programs, start small, health departments, state, local, federal, policymakers, and then globally, who is known as the standard for promoting evidence-based health improvement. So we're going to get them on board, and we're going to look and see what they're saying. Okay, and then let's define respectful discourse and talk about two instances where we could talk about some of the concerns for therapy dogs in institutions. So what does that mean? It means actively listening, acknowledging concerns, and seeking common ground. So the number one, liability. That's what administrators are going to be worried about. That's what nurses are going to be worried about to an extent. So we're going to talk about those things. And when we talk about those things, we're going to talk about, how therapy dogs work, how they're insured, how they're trained. Some of their concerns might be, what if the dog bites? What if it has unpredictable behavior? What if it injures a patient or staff? And who's going to cover that coverage and litigation risk? So a respectful response for that would be, I understand safety and liability are key priorities in this healthcare setting. And then you could share the facts. Emphasize, again, that certified therapy animals undergo rigorous behavioral testing, and handler teams carry liability insurance. And then offer examples where therapy dog teams have worked at their institutions and the protocols they have to reduce the liability risk. Okay, the second one is more specific to patients and nurses. So I have allergies. I'm allergic to dogs. Their dander triggers an allergic response. What are we going to do? So again, I would respond respectfully and say it's important that everyone feels safe in this healing environment. You provide solutions. You're going to advocate for restricted therapy zones. You're going to pre-screen people. Are you allergic to dogs? We're going to have a dog on the unit today. Would you like to see that dog? Get the consent of the patient. And then physical barriers. So we're going to put HEPA filters where the dog is going to be. And you're going to reframe the risk, okay? So these animals are not free roaming. They are going to be with their handler. They operate under strict infection control policies, and they're consent-based. Again, you do not have to see this dog if you don't. Okay. These are some of the allies. Again, some of the other ones specific to nurses are the American Psychiatric Nurses Association and American Nurses Association. These are going to be powerful allies in bringing therapy dogs to the settings. And where are these settings? Where are they allowed? So hospitals, rehabilitation centers, long-term care and skilled nursing facilities, and behavioral health units. All right, change model. So we're talking about Kotter's 8-step change model. And implementing therapy animals requires navigating cultural, clinical, and logistical transitions. So we're going to use this model to create a sense of urgency, Get them excited. Patients are distressed. Staff is burned out. We need to do something to change this environment. What is a low-cost option? Therapy dogs. So you're going to start by forming a guiding coalition across all disciplines and bring that excitement into the planning phase. You're going to develop a vision and realistic implementation goals. How are we going to reach the aim of having 50% increase in satisfaction in patients and nurses? You're going to empower volunteers and supporters from nursing staff and allies and health teams. Remove the barriers through safety protocols, staff training, and managing expectations. And then again, addressing those liability and safety concerns, like liability of a dog bite or what if I'm allergic? And then generate short-term. We're going to start small. We're going to start with our aim in a behavioral health unit. We're not going to expand to the rest of the hospital until we're sure we can make this work and figure out how it works for us in the policies. And then once we have those wins, we're going to build on that momentum and we're going to expand it to other units and find out how it works for them, because it may not work the same as in that specific behavioral health unit. And then you're going to solidify it by making policies, making developmental programs. And the reason this works is because, like I said in the beginning, you're going to create that sense of urgency, and then you're going to logically think through this. So you're going to hit it from both sides, the emotional and the logic side. So it's going to put people in, hey, this is an important issue. All right, thank you for listening today. These are my references, and look forward to seeing all of your videos.